Alrighty. Hello, everyone. My name is Hannah. I'm going to be facilitating the session for today. Dr. Wright, whenever you're ready, the floor is yours.
Okay, great. Um, as Hanan said, my name is Dr. Stephen Wright, and my practice name, as you can see there, is Wright Dentistry. I live in College Station, and I wanted to give you my email so that if you had any questions that you ever wanted to just, any kind of question is great. I've had all sorts of questions from pre-dental society students here at Texas A&M. And we've had lots of students come in and shadow over the years. And so I recognize that, y'all have a lot of questions and don't always know how to ask them. So really no question is a bad question. I think that, my goal for today is, I think more than anything, I feel my road to becoming a dentist is not unique, but it's not traditional either. And so I wanted to spend a little bit of time talking about my journey to become a dentist. I'll tell you a little bit about my office, day-to-day procedures, and then also something that I'm very excited to be involved in. I think, more than anything, one of the takeaways that I would like you to hear me say is that no matter who you are, no matter, what your scores are in dental school or whatever, once you get into dental school, I mean, you are allowed by law to do anything involved in dentistry. And so if your interest is in orthodontics, you could be a general dentist and be an orthodontist and do orthodontics. You could be a surgeon. You could be a periodontist. You could be an endodontist. You have the ability to do whatever you want in the scope of dentistry as a general dentist. So that's one thing that I would kind of want you to hear me say. So to kind of guide us along in terms of my journey, I thought that I would just put some slides up and to kind of illustrate kind of where I've come from. It's now 2020, 2021, and I graduated dental school in 2003. But before that, I graduated college in 1993. Before the advent of internet and far before the advent of doing something like this on Zoom. So crazy to think about. In fact, my wife and I laugh because, and I don't feel like I'm all that old. I just turned 50, but we had to write letters to each other. We couldn't email or talk on a cell phone or anything like that. So the first kind of image there is Furman University. It's a small school in Greenville, South Carolina. And so I spent my undergraduate time at Furman in South Carolina. And then also I ended up getting a master's degree in chemistry from Furman University. So I have a BS and an MS in chemistry. And part of the reason why I stayed there so long is because of the little diagram on the right. So I, growing up, always wanted to be a physician, a medical doctor, an MD. My dad was an orthopedic surgeon. And so I grew up seeing him be able to see patients. He was on call. There would be weekends that he was, at the hospital the whole time. And I guess more than anything, I thought that it was a very valuable, significant profession that he had. He helped people when they had broken bones, when they had pain, when they had chronic disease, and he helped people become healthier. And I also knew that patients were extremely grateful when he helped them. And he got a lot of satisfaction at it. And he was very good at what he did. He loved doing what he did. And, so my goal was to become a medical doctor. Not unlike many students who look at medical school or dentistry or dental school, my grades weren't the top of the class. I did well. I had to work my butt off. And, but even at that, my grades were probably, for the most part, low Bs. And when I started looking into wanting to get into medical school, you have to take the MCAT, the entrance exam for medical school. And so that's why the diagram's there. You can see on that diagram that the average student who gets into medical school is a 31 on the MCAT. And that's not really changed a whole lot since when I was in school, when I was in college. You can see the average applicant made a 28. So when I tell you that my first score on the MCAT was a 19, that's basically saying that if you can fail the MCAT, I pretty much did. And that's part of my story is that, as bad as that was, I still really, really wanted to be a doctor. That was my goal. It had always been my goal. And so I stayed on at Furman and got a master's in chemistry, trying to better myself, which many of you might think about when if you don't get in right away. One thing that I also want you to hear is that I applied to medical school 4 times and never got in. And yet I have a wonderful career as a dentist. And so, there is a wonderful career out there for you. So, I guess the one thing that I would take away is don't ever give up. But sometimes you have to do extra things. So I got a master's in chemistry. I worked with a doctor who is actually testing different types of chemicals as cancer drugs, which I thought was fascinating. I learned a lot. I don't want any questions about bioorganic medicinal chemistry from y'all later on, because I can't answer anything about it now. But back then, that was what my thesis was. So I spent a year doing that. And then I put a picture of Texas A&M to kind of illustrate College Station, because after my master's degree, I ended up coming back to Texas because I wanted to start getting back to Texas, be close to my family. And so I lived here for a few years and ended up working at a doctor's office. I volunteered at an ER and really tried to do things that would make my journey better. During that time in College Station, I ended up realizing that, I needed to do something different. I hadn't gotten into medical school yet. And so I put a little image of Highland Park High School, which is a high school up in the Dallas area, if any of y'all know that area very well. I actually got a job teaching high school science. And so for 3 years, I taught high school science. I taught sophomores and mostly sophomores and juniors, high school level chemistry. I did 1 year of physics, so I taught physics. And then also during that time, I took prep courses, like many of y'all may be thinking about, like the Kaplan course or the Princeton Review course, to try to get into dental school. But I took those courses at night. And so I was pretty busy. I met my my awesome, beautiful wife. We got married while we were in Dallas, while I was teaching. And as I told you earlier, I applied to medical school 4 times. So while I was teaching and while we were in Dallas, was the 4th time that I finally applied to medical school and realized that this wasn't going to work out. And that was a really big blow in my life. I had to make a decision about what's going to happen next. I had to give up a dream, and those things were really hard at that point in my life. And I was at a point that wasn't much older than where y'all are in life. But through that, And through being a teacher at Highland Park High School, I ended up meeting a lady who was on the faculty at the dental school in Dallas. At the time, it was called Baylor College of Dentistry. And she had some kids that went to Highland Park. And so she sat down with me and kind of, just kind of encouraged me to, based on my interests and, what I've done so far, that I should really look into dentistry. And much like y'all are doing here with this Zoom version of kind of shadowing a dentist, not being able to necessarily going to a dental office, but at that time I was able to go into my own dentist. I asked him if I could just come shadow, see what they do. I really had zero perspective or zero picture of what it was like to be a dentist. And what I found from it was that it involved medicine. It involved people. It involved something that I hadn't even considered, and that is kind of art. When you are a dentist, number one, you are meeting and taking care of a lot of people. You're utilizing a medical degree. I mean, the mouth is part of your body, and so being a dentist is basically being an MD. I truly believe that. It doesn't mean don't do surgery. That's for sure. But anyway, I shadowed that dentist, asked him a lot of questions, and realized that I thought that I would really like this. So ended up during that time also taking some extra classes that I didn't have previously. I took a anatomy and physiology course, which I'd never taken before, and I took a microbiology course, which I'd never taken before, and to courses that the dental schools really wanted to see. Did pretty well on those courses. I was pretty motivated. It was during the summer, so it was a little easier to focus on. And out of that, I started applying for dental school and taking the DAT, the dental admissions test, which some of y'all may be thinking about. And you know what? Here's the thing, is that through teaching high school science and physics, taking the Kaplan course, which during the taking the MCAT is a very rigorous reading test, which I'm not good at reading. I'm not really good at reading comprehension. That's not my forte. But through doing all of those, things in my life, those tasks, trying to get into medical school, honestly, I mean, I didn't ace the DAT, but I will say that I got a very high score. And I think because of that and my background, I think dental schools looked very favorably on me, and I was able to get into dental school in Texas. And that's another thing that I would say, is that there's not a bad dental school in Texas. In fact, I would say probably our three dental schools, I mean, this is a guess, but I don't think it's too far off, easily within the top 10 dental schools in this country, as being the top 3 in the top 10 of dental schools in this country. They're excellent dental schools. They're excellent dental schools because they have great faculty. They're great dental schools because of the way that they find patients for you to treat. You get to do a ton of dentistry while you're in dental school. So when you come out, although you have a lot to learn when you come out, you are also very experienced in a lot of things that a lot of dental students coming out of dental school have no clue. For example, when I was in dental school, I did I probably did 6 root canals, just as an example. And root canals are basically a procedure to save a tooth by taking the nerve out of the tooth and the blood supply out of the tooth so that it doesn't hurt the patient. But anyway, there are dental schools in this country where dental students come out of school never having done a root canal. And in some ways, that's kind of a scary thought, that, there may be someone coming out of dental school having never really done a procedure, and, or maybe have only done it once, and you may be the first patient they do it on. So that happens in certain parts of the country. Or in other parts of the country, you almost have to pay people to come in to see you to get your requirements and things like that. So anyway, all that to say is that I applied to the University of Texas Health Science Center in San Antonio and got a great education, which after 4 years of dental school, I was able to put DDS by my name. And so I moved to College Station where I practice today. And so to just kind of answer a few questions that Hanan had asked me about, what kind of dentist am I? I'm a general dentist. In fact, I tell my patients that I'm about as general a dentist as they come. This is my office in South College Station, and we do root canals and extractions and fillings and crowns and all sorts of stuff. And that's because I love doing it all. There's many dentists who choose not to even do a root canal. There's many dentists who choose not to even do an extraction of a tooth. But I just like all aspects. And again, just to really emphasize this is that when you become a general dentist, you do have the ability and the wherewithal and legally to be able to do whatever kind of dentistry that you want to do. So, I didn't specialize for that very reason. I didn't want to limit myself in a certain area. And I'm not saying that I wouldn't have been happy being an endodontist or an orthodontist or an oral surgeon, but I just, and I guess to a certain degree too, I'd been in school so long at that point and done so much, I needed to make some money. I was married. I had 2 kids at that point. I needed to start working and making a living and being able to provide for my family. And so that was kind of the main reason why I decided to not to specialize, which kind of lends itself to what were the deciding factors for your job. So I'll go on to private versus corporate. So the types of practices that are out there are you can work in a private practice, which means a dentist owns the practice. It's usually a practice that's owned by 1 or 2 dentists. And so it's small in terms, it may be a corporate, they may have a corporation, but it works very much like a mom and pop type business, if you will. And I believe in private practice. I have started from the very first day I was a dentist. I worked in offices that were private practice. They were owned by dentists. And the reason for that is that they wanted to be able to decide and dictate how they treated their patients. They wanted to be the ones in charge. When you hear about corporate dental offices like Monarch or Heartland, I know there's a bazillion of them out there, but any kind of corporate dental office, it runs like a corporation. It's meant to be, the bottom line is being profitable. The bottom line is being able to see as many patients as you can. And part of the reason for that is because those corporations choose to take a small fee to do important dentistry. And so in order to make a lot of money in a corporation, you have to see a lot of patients. And when you see a lot of patients, you have to work really fast. And when you work really fast, that can lead, unless you are just fast, and not many people are, but that can lead to mistakes or bad decisions or choosing to do dentistry that shouldn't be done. And I've seen all that. Now, that's not to say that every corporate dental office is like that. And there's probably corporate dental offices that really work hard at being having a high amount of integrity. But the bottom line is that any corporate office is taking a reduced fee for the services that they give. So it does put a squeeze on them if they're not seeing a lot of patients. And I'll answer questions about that if you'd like at the end. Are there any important factors to look at for when applying or accepting jobs? I think that I think there's probably 2 ways that you will decide if you get into dental school and you're about to get out. You're going to probably make a decision one of 2 ways. I think that you're going to try to make a decision based on location, meaning you want to be close to family, or you want to be close to a certain city because, I don't know, maybe you want to be in Colorado because you're close to the mountains. So something geographic or, related to family. The other way you would decide that is a lot more analytical, and that is finding areas that have a need. that may not have a lot of dentists, or you find areas where the dentists are thriving and doing well in that community, and have a need for more dentists. And so that would be the more business way of looking at it, or analytical way of looking at where to apply for a job. Personally, my wife and I really, truly had a desire for our kids to be around their grandparents. And so we moved back to College Station and worked here near Texas A&M. Now, having said that, my first job wasn't my last job. The person that I started practicing for here in Bryan College Station, we ended up having to part ways. And that was because, the business that I chose to work in and apply for didn't have enough work for me. We kind of went in on it saying, let's try to grow this, and it didn't happen. And so as the associate dentist, as the dentist that was for hire, if you will, I was expendable. So I was let go. But it did lead me to an amazing situation with another doctor. And I became an associate of his. And, I worked for him for a few years and then bought his practice out, and then moved and built the building that I'm in that you see there in the picture. And, now after 5 years, I've taken on a business partner, and he and I now are going to be growing this business. And so anyway, I'm very excited about where I am and pleased where I am. And I think that if you go into dentistry for the right reasons, there's one thing that I can also tell you as advice, and that is that if you go into it with the right heart and the right mind, every single year that you work as a dentist, you'll start making more and more and more money, and have enough to live on and provide for your family. It is an amazing field. I think patients in dentistry are phenomenal because they're put into situations that are they're very anxious. There's some of you in and of yourselves that may be anxious going to a dentist. In fact, I had a colleague, a dental student friend of mine, who became a dentist in Austin, and but if she had dental work done on her, she was absolutely terrified. But then she became a dentist, probably because of that fear, and wanted to help other people that had a fear for dentistry. So dentistry is a great field. You can, speaking of factors of taking jobs and things like that, you can go to work for a corporate office. You can become an associate dentist, which means that basically you're an employee. You go to work as a dentist in a dental office for another dentist. And that is a great way to get your feet wet, to learn dentistry, and not have all the stresses of owning a business. You can go hog all in right out of dental school, and you can take a loan out and start your own practice and put your name out there and grow it from there. And there again, there's no wrong answer there. It's what you can stomach, quite honestly. I did not have the stomach for having that risk of going out on my own. The idea of being an associate under another dentist, and knowing that I was going to have a salary, knowing that I was going to, at least have some amount of money that I knew I was going to make, was very helpful for me and appealing for me. So what do I do on a day-to-day basis? Again, I love doing dentistry, and it's because I get to do all sorts of things. And this is one area of dentistry that I believe is revolutionary, and it is basically being able to provide patients a tooth-colored or a man-made tooth, let's put it that way, made of porcelain in one day. For decades and decades, dentists would prepare a tooth like you see there in that X-ray on the right. Any one of those teeth, kind of prepare it. And what I mean by that is you take a little bit of tooth structure off the top, you take a little bit of tooth structure off the sides, so that you can put a man-made tooth on top of that, biologic tooth. And so you can see my cursor, I hope you can, but I'm kind of outlining natural tooth right in here. And then right in here is actually porcelain in the shape of a tooth. And you can see that it's nicely sealed. But that was made in the course of 2 hours. Whereas before, we would have to prepare that tooth. We would make them a little temporary version of this little tooth made out of basically plastic, let them go 4 weeks and come back, and then take this off and then put the permanent one on. Now what we can do is we can take this little CEREC machine. It's called a CEREC machine, but basically it's a computer. And on the side, and forgive me, I think it's not quite in view, but there's a little camera on the side that you scan the person's mouth. And on the computer, you can design, much like you see here on the computer screen, a man-made tooth. And then you can send that information that you want that made over to a milling unit right here. And if you can see right in the center, there's a little square, and that's a block of porcelain right there. That is, then there's these little drills on the side, and basically it drills that little square down to that shape. And then that little crown, man-made tooth, is put into an oven at around 1700 degrees in this little oven right here. And basically, if any of y'all have done any kind of ceramics, like made a plate, a vase, or anything like that, you know that it has to be fired. It has to go in a kiln. Well, basically, this oven is a kiln for dentistry. And so you heat that up, you harden the material, it comes out the color that you want it, and that you're able to put within 2 hours, be able to put a tooth like that, like this, in the mouth that fits perfectly. I mean, it honestly is absolutely amazing. I mean, it is just so cool to be able to do that. So a lot of technology is involved in dentistry these days. A couple other areas of dentistry that I really enjoy. On your left, and forgive me, I didn't have a lot of great x-rays, but or a lot of pictures, I should say, but this is an example of a tooth that had an abscess down at the bottom. The tooth or the patient was having a lot of pain. So we did what's called a root canal, which basically means this space right in here that's dark is where the nerve of your tooth is what gives you feeling. And you have nerves that come from your brain that come right inside that tooth right there. And it also has a blood supply. And we use these little instruments, kind of files, and we basically pull all of that material, that nerve tissue, blood tissue, pull it out of the tooth to make it basically a hollow shell. And then at the very end, we will seal that area off with a plastic type material that fills in that gap that used to have a nerve and a blood supply. And then on top of it, we would put a crown on top of that. So a lot of technology and thought process goes into being able to do these types of procedures, but it is very satisfying to get someone out of pain. Honestly, probably one of the most satisfying things is to be able to call a patient up the next day who's been in just crazy pain, and they're like, you know, I'm a new person. I have zero pain. Thank you so much. You know, an area that is a lot more complex than a lot of the things that we do is being able to, you know, someone who has really worn down teeth or broken teeth or decayed teeth, they need many crowns. They may need a lot of these crowns. And so for various reasons, we can take a mouth that looks like that and make it look like that. And that in and of itself too is transformative. And I didn't put the pictures of the patient's smile, but basically, that person's just whole demeanor, whole confidence level changes when they can have dentistry that improves the look of their smile. You don't ever discount the power of being able to smile and what that conveys, and the confidence that it takes to smile. It really is amazing. You'll find that people who have a lot of cavities or aren't happy with their smile, they don't smile. They don't show their teeth, and you can visually see that, and it shows up in their personality. It shows up in how they act, how they talk. So when you're a dentist, you do have an effect on a person's whole body, both emotionally and physically. Definitely believe that. With the last a few minutes that I have, I wanted to kind of tell you about an area that I'm very passionate about, and that's dental implants. As you can kind of see, a dental implant looks like a little screw that you would put in wood, maybe. I don't know if you can see that, but basically, dental implants are man-made roots, much like you see here in this image, and much like you see over here in this image, with a man-made tooth on top, much like you see in these images right here. So there's the implants with those crowns trying to mimic what God gave us. And I mean, that now is the standard of care for being able to replace a missing tooth. And over 54% of people in this world have at least one missing tooth. There's a lot of statistics, and it's only increasing as people live to an older age. And so dental implants is cutting edge. It's needed. It involves a lot of thought, creativity, science, art. I mean, it takes everything you know about dentistry to be able to do that. And just to kind of give you a little tidbit of what I'm doing now, I wanted to show you a little video, if I can bring this up. So I'm going to try. What I'm going to show you here is to go back for a second. If you look right here where the natural teeth are, all of us have a natural place where our gums reside. And there's a relationship between your bone underneath the gums, your gum tissue, and the part of the tooth that you see. And so, you know, when you're trying to do implants, if you the risk is that when you put the implant in and you put that crown on top, that it kind of looks fake. It doesn't look right. It looks like something there that shouldn't be there. And so there is new technology, new science that where we utilize a person's actual tooth in order to trick the body into leaving the bone and the gum tissue right where it is when the natural tooth was there. So for example, in this picture, what I want you to kind of see is the red is the gum tissue. The next layer is the bone. The next layer is actually a sliver of tooth that was left when the tooth was removed and an implant was placed in there. And so I'll just show you the video and I'll kind of explain it as we go. See if this works. So just real quickly, many times we have patients that come in with a tooth that's broken off at the gum line, just like you see in this image here. So going back just, let me see if I can get this to go back just a second. Sorry, forgive me. I'm not good at doing this, but shucks. Well, what I wanted to, so I can kind of illustrate it in the next slide, I think. Okay, so this is an actual patient who came in to see me. Came in to see me with a broken tooth, as you see up here on the top left. After we basically did just like you saw in that video, we took most of that tooth out, left a sliver, and here is an image where you see a file in the bone along with the little sliver of bone right here. And so again, the reason you do that, the reason you leave that little sliver of bone is to trick the body into thinking the gum tissue and the bone needs to stay right where it is. So wherever this gum tissue is right here, that's where it's going to be when we put the implant crown or the man-made tooth on top of that. So here is another image of a post on top of the implant. My assistants, that's another thing I love being able to do, is teach my assistants to be able to do some pretty amazing things. Them by themselves as dental assistants made a temporary crown that went on top of that implant. And so now the patient left that same day with, although a shorter one, so it's not perfect yet, but a temporary crown when they came in looking like this with a broken tooth, and they didn't have a tooth there. So we took it from that to that in one day. And the reason it had to be shorter is that the implant has to integrate, meaning your bone, your natural human bone, has to grab onto that implant and integrate, or basically bond to it or glue to it, so that it's fixed in that bone and it's a part of your body at that point. Then you can start putting a lot of stress on the teeth. So we kept that tooth short so it wouldn't really hit real well on the bottom teeth. Was always taught when you do a speech or do a talk or anything to kind of show pictures of your family. And so I thought I would end with this one. This is my family when we went hiking down at Big Bend. And this was in one of the trails called the Window View. And we had an amazing time hiking in that area. We've been to a few national parks now and really enjoy doing that. And so anyway, that's my 3 kids, my 2 boys and my daughter, who's now a freshman at A&M, and then my wife, Allison. So with that, I will take any questions. So I'm going to stop sharing. I think I'm going to stop sharing my screen and give it back over to Hanan.
Yes, thank you so much, Dr. Wright. This was an amazing presentation. Thank you so much for all of the information regarding your journey, as well as, the different procedures that a lot of us and hopefully will get to see in the future as dentists. So we have some questions piling up for you. And the first question is, let's see. So how expensive is opening up your own practice?
Yeah, so that's a great question. So I think that I would say the most common way of opening a practice would be to lease a space. So let's say you saw some strip mall, and just like you might see a nail shop, you could see a dentist there. Maybe you know what I'm talking about. So you open up that it's just a shell, and so then you have to pay to have the inside of that shell. Walls and paint and furniture and all of that stuff. Now you can negotiate with the landlord to pay for some of that, but I'd say kind of in the range of maybe I'm going to say $100,000. And then depending upon how many rooms or operatories you are going to outfit, that could also range within $100 to $200 to $300,000. Now that sounds like a lot of money. So that's $400,000 now that you're down. But the thing about it is that you are investing in yourself. And dentistry is a wonderful field. And if you're doing it for the right reasons, you are going to have patients come see you. And it may start off slow, but it'll slowly grow. People will slowly start to see that you're there and that you can help them, and you'll start providing. Dentistry is not cheap. And so when you think about $400,000, it sounds like a tremendous amount of money. But just to think about even overall, probably the average cost in a dental office for a crown that I was showing you with that CEREC machine is probably in the range of like $800. So I would say that most dentists probably average, 20 plus crowns a month. And that's just crowns. Then you add in, an employee, a hygienist who does hygiene for you. I guess the bottom line is that I think that if you got a loan for $400,000 as a dentist, number one, you'd get it. Number two, you'd get a pretty decent interest rate, and you'd be able to make that payment if you work hard and recognize that at first, it's not going to just immediately happen, and the banks know that too, and so they work with you the first, 6, 9 months. That maybe you're only paying interest on your loan for that to get going, and then you start paying the principal on the loan. So I don't know if that gives you a pretty good answer, but that's what I would say to that.
That was amazing. Thank you. Also, I think a lot of us are really curious about how is essentially being a dentist in the real world different from like dental school?
um, I think, well, I think number one, I think dental school, you're definitely going to have a lot more book work. Um, I think in dental school, you only get a taste of the procedures that you're going to have to do when you get out. And what I mean by that is that when you get out of dental school, you're going to have a very small basis of knowledge to be able to see patients. And every day that you practice, every patient is different. And you're going to have to learn to take what you learned in dental school, be creative, and to problem solve certain situations. I mean, there's only a certain number of types of fillings that, let's say, or a certain number of types of patients where they need dentures. And so you get to do the basics. So when you get out of dental school, number one, you're going to start seeing cases you never saw in dental school, and you're going to have to decide whether you're going to figure it out or not. And the way you figure it out is by taking more continuing education, learning how to do things, even if it's about just learning how to do a composite, something simple like that, learning how to talk to patients, different technology on how to be able to show a patient what they need to get done, get better at selling your dentistry, because the bottom line is that you are in the business of health, meaning that when you become a dentist, you are a business person. You are selling a product. It's a very valuable product because it affects their life, it affects their body. But I mean, bottom line is you're selling health. And so in some ways, you got to be a good business person. You got to be able to speak to the person and give them the information for them to need that they need in order to know that they need a procedure, which is another difference. You don't really have to sell dentistry when you're in dental school, because these patients are already coming to the dental school to get inexpensive dentistry, and they know that they're coming in to have dentistry done by a dental student. So, I mean, I think that those are probably the biggest things that I would say are the differences. No, I think that's a great question, and I think that when you come out of dental school, another difference is that you don't have, or let me put it this way, you probably have very little knowledge on how to run a business, um, how to run QuickBooks, how to run a budget, how to, how to file insurance for patients. I mean, anything. I mean, you're learning so much. You've learned how to do fillings and maybe root canals and extractions and dentures, but you haven't learned how to run a dental office. So the biggest thing is that the biggest challenge is learning to do the stuff that you weren't taught to do, and that's one of them. But I think probably the biggest hurdle, and most dentists will say this, is that the biggest hurdle is probably managing people. That is just a big deal that none of us were taught. Most people who get into dentistry's personality is not one of being a go-getter leader for a business. And so most of our personalities are such that we love helping people. We want to serve. We have great personalities. We love people, but you know, managing people isn't necessarily high on the list of things or reasons why you decided to go to dental school. And so I think managing employees, managing payroll, those are probably the two biggest things that I would say are the biggest hurdles that I had to overcome. And and for me, I had the pleasure of having a wife who is very good at numbers. And so she and I have always been partners in our business. That'd be great. Well, the reasons why I chose the procedures I did in the slideshow are the ones that I love to do the most. My biggest passion right now, and the one I spend probably the most time on in terms of learning, and I've been doing dental implants for 10 years now, and I am always learning. In fact, right now, I'm taking a continuing education course online because you can't go to courses right now, but I'm taking a course online right now to become better at doing a certain aspect of dental implants. So I'd say that number one is my number one favorite. Beyond that, on a day-to-day basis, though, again, I love endodontics or root canals. I love being able to get someone out of pain. I love doing crowns because you know, just the technology, being able to make that crown, make something for a person that fits perfectly in their mouth and that they can eat and chew on, and that's strong. I mean, it's just that's a phenomenal thing that we can do in our offices, whereas before we had to utilize dental labs, and there still is a place for dental labs and dental technicians, and unfortunately we're not going to have many of those in the future. Maybe when y'all become dentists or been out for a while, because of technology, because of the machine that I was showing you is going to be able to do more and more and more. I like doing simple fillings. I like being able to treat cavities and be able to shape and mold a filling into the person's mouth that looks exactly like the tooth that they had there. I mean, it takes a lot of patience and skill and art, and takes a good eye. So I love doing that. So there's just a lot of things that I love about dentistry. Um, I do. I definitely do remember my interviews, and I mean, I don't remember the questions per se, but I can remember them. And I guess the biggest advice I would say is to really think about maybe some non-traditional reasons why you want to become a dentist. And what I mean by that is, I think everyone would say, I want to become a dentist because I want to help people. Well, every single person says that. And so I think that if you can kind of really think going into an interview, what are besides that, which is definitely true, and you can say that, but you can also say, but here are some other reasons why I want to become a dentist. And maybe it's something, I've always been fascinated with just the fact that doctors in their relationships with patients and that dynamic, maybe it is, I want to be an entrepreneur. I want to own a business. I have a friend who's a dentist. He became a dentist so that because he knew that it was a type of business that he could run that would make a good living. So he has a desire to lead people and to run a business and make it successful. I do it because I have to, if I want to make a living. But he does it because he really loves the business aspect of it. So I think just being prepared to about why you want to be a dentist. I think really, if you're not someone who has a very outgoing personality, you really need to spend some time talking to people. I say something that I tell my kids. I mean, when you're in the grocery store and you're looking at, some product, maybe different potato chips, and someone comes up next to you, I mean, get in the habit of learning to just, make some comment to that patient, like, can you believe how many bags of chips there are in this place? Um, be able to talk to a stranger and be able to be confident at that. I think people need to see your confidence, because they need to know that you can handle what it takes to get through dental school. And I think that that's one thing, is being able to deal with your professors, with other students, things like that. Yeah. That's a great question, because I don't think it's necessarily a bad thing to have a gap year. More and more people are doing that. I think that a gap year can be utilized to solidify your interest in dentistry. And I would say that two things that I've seen over the years with people who've been in my office that have gone to dental school, or gone on to dental school. I think one, consider becoming a dental assistant. Quite honestly, to become a dental assistant, all you have to do is pass a test. And if you've gone through college, you probably could pass it right away. Look into becoming a dental assistant. And then look around and say, I want to be able to, and find some dental offices, get a resume together and say, a resume that says I want to be a dental assistant. I'll take a lesser salary that makes it good for the dentist. But when you're someone like that, you're so motivated to learn. You're smart. You'll do a fantastic job as a dental assistant, and you'll learn so much. And even the dental assistants will teach you how to become a better dentist. I mean, even what the dental assistants will teach you will be invaluable. So I think that that's one. I think that another thing that you can do along with that is there are some courses that you can take to better your GPA, if you will, that are online these days, or maybe it only meets once a week. And so you can, work it out with the dentist where you're only gone very minimal time, and so you're in their office a lot, and so they're able to utilize you. And if you can say, hey, I can commit to being here a year. I really want to go to dental school. Would you consider hiring me? I think that would be awesome. At the very least, take that gap year, get a job doing whatever, but be able to spend some time shadowing dental offices on a consistent basis. Maybe one afternoon a week, offer to do just free work for a dentist. And maybe it's just sterilization, learning to just clean the instruments for the assistants. The dentist would be happy, the assistants would be amazingly happy, and you still would learn a lot. So just getting that experience. I think if your GPA is a bit of an issue, then taking some course is always a good thing, and being able to show, hey, I was working and I took this course and I still made an A. And that means a lot to the dental schools. Or working on getting your DAT score up. The little bit I know about DAT scores, I think the scale is still about the same. But I mean, I think that if you want to feel good about getting into dental school, you need to have a DAT score, I think, of 20 or greater. I think that's probably accurate. It may be 21 or greater. So if your DAT score on average is not that high, then being able to use that gap year to really work on the areas that you need to for the DAT. Well, it really was fun for me to do. I do hope that anyone who is out there listening on the y'all's YouTube channel for Fresh Dental Shadowing, number one, thank you for listening to me, and just good luck. I hope that all of y'all achieve what you want. And please, if you have an email, excuse me, if you wrote down my email, it's very easy. It's office@wrightdentistry.com. Just email me, tell me that you saw this and that, whatever questions, and I'll get back with you. I promise it may take me a day or two, but I will get back with you. So, but anyway, thank you again for the opportunity, Gabriel and Hanan, and good luck in the future. Okay.